Chapter 7, Lifespan and Development. Humans develop throughout their lives. EMTs must be aware of the physical changes a person undergoes at various stages of life, and it may affect the approach to patient care. Neonates is the age range of birth to 1 month, and infants are 1 month to 1 year, and they develop at a startling rate. Vital signs at birth, their pulse rate is 90 to 180, respiratory rate is 30 to 60, and then shortly after birth, the pulse rate drops to 100 to 160, respiratory rate slows to 25 to 50 breaths per minute, and by 1 year of age, respiratory rate slows to 20 to 30 breaths per minute. Blood pressure directly corresponds to the patient's weight, typically increases with weight. So as they grow, their blood pressure is going to increase. The average weight of a neonate is 6 to 8 pounds at birth, and they grow at the average of 1 ounce per day, and their weight will triple by the end of their first year. Cardiovascular system. At birth, a neonate makes transitions from fetal to independent circulation. And the pulmonary system, infants younger than 6 months are prone to nasal congestion, and infants have larger tongues and shorter, narrower airways, so airway obstruction is more common than older children or adults. The nervous system. Evolution continues after birth. Um, Here's the Moro reflex. A neonate opens their arms wide, spreads their fingers, and seems to grab at things. This is when an infant gets startled. That's their reaction. That's their reflex. Palmar grasp occurs when an object is placed into the neonate's palm. Rooting reflex is when a neonate instinctively turns their head when something touches its cheek. And the sucking reflex occurs when a neonate's lips are stroked. Fontanelles is the spaces between the bones that eventually fuse to form the skull. The posterior fontanelle fuses by 3 months. The anterior fontanelle fuses between the age of 9 and 18 months. These are the soft spots, if you've ever noticed, and a lot of times people will say be careful with the baby's head, don't touch the soft spot. That's what the soft spots are, is the fontanelles are not fused together to complete the skull yet. Infant's immune system maintains some of the mother's immunities. Here's a diagram of your fontanelles. It's also in your book for reference. Psychosocial changes. They begin at birth and evolve as the infant interacts with the environment. The table over there is noticeable characteristics at various ages. I would glance over those and be familiar with each stage, each age, and characteristics of those, just for test purposes. Crying is the main method of communicating distress. Obviously, since infants and babies can't talk, the only thing they can do is cry. Infants develop relationships with their parents or caregivers at different rates. Bonding is based on a secure attachment. Anxious, avoidant attachment is found in infants who repeatedly are rejected. Separation anxiety is common in older infants, and trust and mistrust involves an infant's needs being met. Toddlers, that's going to be 1 to 3 years of age. Their pulse is going to be 90 to 150 beats per minute. Respiratory rate 20 to 30 breaths per minute. Systolic blood pressure is 80 to 100, and their normal body temperature is 96.8 to 99.6. Preschoolers, age range of 3 to 6 years. Their pulse is 80 to 140. Respiratory rate is 20 to 25 breaths per minute. Systolic blood pressure is 80 to 100. Weight gain should level off by the time they've reached preschool age. Their passive immunity is lost, so they'll no longer have any immunity from their mom. but the toddlers will acquire immunity as their bodies are exposed to various viruses and germs. Neuromuscular growth also makes considerable progress at this age, and the average age for completion of toilet training is 28 months. They're going to learn to speak and express themselves. They're going to master basic language. They're going to be able to interact and play games with other children. And they're going to begin to understand cause and effect. And they're going to learn to recognize gender differences by observing role models. School-age children, 6 to 12 years of age. Vital signs approach those in adulthood. Their pulse is on average 70 to 120. Respiration rate is 15 to 20. And systolic blood pressure is 80 to 110. Obvious physical traits and body function changes become apparent. They have a growth of 4 pounds and 2.5 inches each year. Their permanent teeth will come in, and their brain activity increases in both hemispheres. Psychosocial changes. Pre-conventional reasoning. Children act to avoid punishment and get what they want. So this is where a child's going to behave for 30 minutes while they're in Walmart to get that game or that, toy or to go where they want to go. Conventional reasoning is children may look for approval from peers and society. Post-conventional reasoning is where children make decisions guided by their conscience. Self-concept and self-esteem develop. Now remember, self-concept is one's knowledge about oneself, like who am I? While self-esteem is one's attitude about oneself. Adolescence, this age range is 12 to 18 years. Vital signs level off, pulse 60 to 100 beats per minute, respirations 12 to 20, and a systolic blood pressure is 90 to 110. They have a 2 to 3 year growth spurt, and girls finish by 16 years of age and boys by 18. Reproductive system matures, their secondary sexual development takes place, voices start to change, menstruation begins, and acne. Adolescents and their families often deal with conflict. Privacy becomes an issue, and self-consciousness increases. Adolescents may struggle to create their own identity. Antisocial behavior and peer pressure peak at age 14 to 16 years. During this age range, some teenagers will begin to smoke, use illicit drugs, unprotected sex, eating disorders. A lot of this age group females, will see themselves fat or, feel like they don't fit in, and that's where they begin to have eating disorders. Code of ethics develops and high risk of suicide and depression. Early adults, 19 to 40 years, vital signs do not vary greatly. Their pulse is 60 to 100, respiratory rates 12 to 20, with a systolic pressure of 90 to 140. From age 19 to 25, the body should be functioning at its optimal level. Lifelong habits are solidified. Psychosocial changes, life centers on work, family, and stress. And this age group is where people start settling down, getting married, and having families. But it is also one of the more stable periods of life. Middle adults, 41 to 60 years of age, vital signs remain the same. Pulse 60 to 100, respiratory rate 12 to 20, systolic blood pressures 90 to 140. They are vulnerable to vision and hearing loss. Cancer incidence increases. Menopause occurs in late 40s or early 50s. Diabetes, hypertension, and weight problems are common. Exercise and healthy diet can diminish the effects of aging. Now back to the diabetes, hypertension, and weight problems. Those become more of an issue because as people get older, they become less active but a lot of people don't change their diet. And so when you're eating the same with less activity, you have the weight gain, and then which that can increase your blood pressure, and then we can have an onset of diabetes, type 2 diabetes. Psychosocial changes, they're going to focus on achieving life goals. They're going to readjust lifestyles as children leave home, generally have physical, emotional, and spiritual reserve to handle life's issues, and they may be caring for both children leaving for college and aging parents. So at this age frame here for middle adults, you've got elderly parents and you have college age children. So they're dealing with empty nest from their children going off to college, but this may also be where they're taking in their elderly parents to begin caring for them. Older adults, 61 years and older, the life expectancy is constantly changing. Now it's approximately 78 years is the life expectancy for an older adult. Vital signs depend on the patient's overall health, medical conditions, and medications that they're taking. And older adults are often able to overcome numerous medical problems but may need multiple medications. Cardiovascular system, it declines with age largely due to atherosclerosis, heart rate, cardiac output decrease. Their vascular system becomes stiff, and the ability to produce replacement blood cells declines, as does their blood volume. Respiratory system, size of the airway increases, surface area of alveoli decreases, and the natural elasticity of the lungs decrease. They're going to be using their intercostal muscles more to breathe, and their breathing's gonna become more labor intensive. Respiratory system, aspiration, and obstruction become more likely, and by age 75 years, vital capacity may amount to only 50% of a young adult's vital capacity due to loss of respiratory muscle mass, increased stiffness of the thoracic cage, decreased surface area available for the exchange of air, and then their residual volume increases. Endocrine system, insulin production drops off, metabolism decreases. People tend to slow down their physical activity but do not decrease their food intake. This is what we were talking about a couple of slides back. The reproductive system changes to some extent. Endocrine system, men are able to produce sperm, but the rigidity of their penis decreases over time. Women have a decrease in the size of their uterus and vagina. Hormone production for both sexes gradually decrease. Sexual desire may diminish, but it does not cease. Digestive system, taste sensations decrease, the saliva secretion decreases, the ability of their intestines to contract and move food diminishes, gallstones become increasingly common, and anal sphincter changes can produce fecal incontinence. Renal system, filtration functions decline, kidney mass decreases by 20%, decreased ability to clear waste from the body, and decreased ability to conserve fluids when needed. So that's why we have a lot of the older people on dialysis, is because they do lose the ability to clear their bodies, the waste from their bodies. Their kidney mass decreases, so they have less output. That's where we have, um, or the filtration function declines. That's where we have the issue of the dialysis patients. And I know we have some younger adults on them. We have people of all ages, but it is majority older adult um, would be your age classification for most dialysis patients. Nervous system, motor and sensory neural networks become slower. The neurons are lost, but there is no loss of knowledge or skill, and sleep patterns change. Age-related shrinking creates a void between the brain and the outermost layer of the meninges. Peripheral nerve sensation is diminished. Increased reaction time causes longer delays between stimulation and motion. Slowdown in reflexes and decreased kinesthetic sense may contribute to falls and trauma. Sensory changes. Most older adults can see and hear well. They may need glasses or hearing aids. Visual distortions are common. Hearing loss is 4 times more common than vision loss. Psychosocial changes. Until about 5 years before death, most people retain high brain function. Statistics indicate that 95% of the elderly live at home. Financial limits may restrict access to health care or medications. Psychosocial changes. More than 50% of all single women in the United States who are 60 years of age or older are living at or below the poverty line. Elderly need to face their own mortality. Isolation and depression can be challenges. And that concludes Chapter 7, Lifespan and Development.